When patients come to us as either a new patient or they're curious about maybe other services, we will bring them back for a consultation, and the most important part is analyzing their face. Just kind of a blanket statement, is a patient a candidate for dermal fillers? It really depends on, first of all, their specific concern, their facial structure, what has changed with their face over time with facial aging, also their beauty budget. So dermal fillers are a wonderful option. They may be great for some patients, but not great for others. But this is why it's imperative that you go to a licensed professional who can properly evaluate your face, has education in facial aging, and knows how to properly address if someone is in need of dermal fillers. And then a caveat to that is that they're placing the dermal fillers in the appropriate plane, in the appropriate area of the face. When I analyze a face, especially a female face, I'm looking at the upper third, the middle third, and lower third of the face. Most women, as we start to age, unfortunately, we start to get some jowling here in the marionette lines. We start to get real square in the lower face, and our skin becomes more lax with that loss of collagen and elastin and it collapsing in ourselves. What we and most licensed professionals, what we're looking at is restoring the natural volume of the face. This is not a procedure where we want our patients to look false and fake. I have thousands of patients running around Kansas City with dermal fillers and no one would ever know it. The reason is because they were placed appropriately. There are fillers that are static, so when you inject them, they stay and they do not really migrate or move. We also have dermal fillers that are more dynamic. They may migrate a little bit more, but they, when you talk or you move, are moving with you. So I really like to utilize fillers that are more dynamic, especially in the lips, the lower third of the face, but it is imperative that you're restoring the natural volume of the face first before you're just adding filler to some area. So if someone is pretty set on dermal filler and they may not be a great candidate, we likely have a whole slew of other treatments that we can recommend. The most important thing is, the exam and their concerns, beauty budget. There are other injectable treatments. One of them is my favorite. It's called Sculptra. It's a polylactic acid that stimulates your body's own fibroblasts to build collagen. Some clinics utilize it and kind of call it a dermal filler. I don't like to exactly utilize it in that space. It's more of a biostimulator, but they may be better candidates for a product like that. It takes about 3 to 6 months to see the result. It's usually a little bit more natural look. It can be a more natural look. The nice part about Sculptra is that it's not that immediate result, which, a lot of patients that we see, they want that immediate result. They want the dermal filler. Well, it may make sense, depending on beauty budget, we may start with dermal filler, and then we may, several months later, when the dermal filler is starting to, kind of disintegrate, filtered out through your lymphatic system, be metabolized, then the Sculptra, we've injected that. Now it's really starting to kick in and your collagen's being stimulated.